And in doing so, people might be able to do a playback. But thank you for the few people that are here. I'm so glad that you're here. Dr. Wen, I want to hear a little bit, if you can tell us about your beginnings of practicing acupuncture at 12 years old. I mean, that's a tender age.
Yes, that is because my mom is an OBGYN doctor. And then during the Cultural Revolution, so she was sent to the countryside as a barefoot doctor at the time. In the village, she's in the village, I was 12 at the time, with 100 families. They don't have money. So they don't have money to buy medicine or herbs or anything. So she had to give them acupuncture. At the time, the acupuncture was not disposable. Now it is disposable. So that was the cheapest thing. So she will go to, if somebody has a problem, she will go to their house and perform acupuncture. And then she will teach me. So I learned from her. And at that time, but I wasn't using it. I mean, in China, I went to the Western medical school, but we still have about 100 hours of traditional Chinese medicine. So we have to learn acupuncture, we have to learn herbs, and we're also doing internship and in the traditional Chinese medicine clinic. So we see patients like that.
Oh, wow. And I mean, it is, why, can I ask you this? People are trying to get in. I want to know from you, I think my question would be like, why is it so, well, how does it work? Like, I mean, literally you can go walk in with the pain, you're sticking these needles in, and how does it relieve that pressure? Like, how does it work?
Actually, to tell the truth, people has even till now they still don't know the real mechanism, but there are proposed theory about how it works. So they think the body, at least Chinese people think has meridian. So what is a meridian? Meridian is kind of like network of nerves, the blood, the nerves, lymphatic system, and the blood vessel all together. So I usually balance. I'm currently doing acupuncture. Actually, it's been used thousands of years, but it has different things. I'm doing like a balance technique. I'm doing the things to balance the meridian, where you have a problem, to open it up and to help.
Wow.
They think for pain per se, they raise your endorphin level. So endorphin is your body's like morphine, your body's thing. So it's actually very calm. I do believe acupuncture is a very, very good way to decrease stress. And yes. Yeah. So that can help a lot.
I know for me, I found you because I was in a moment of pure and complete desperation. Remember, we had our first call, and I don't mind opening up to my spiritual bae. That's what we call each other, my spiritual baes, about what I've gone through. After my father passed away, I suffered from, I guess, some type of ear infection that perhaps I let go untreated, and I lost, they stated 70-something% of my hearing. And I literally could not hear out of that, my left ear. And I was experiencing the worst type of, is it vertigo? That I had never experienced anything like that, to the point of crawling on the ground. I could no longer drive. I was just like, this is getting worse and worse. What's going on? I kept going to the ER. They're running all this tests. I'm getting all of these bills. And no one could get it. Like, you're fine. And I'm like, I'm telling you, I'm not fine. And then they put me on this medication that made my stomach worse. And that's when I found you. And you said, you know what, just come in. And now I'm healed. Do you want to talk a little bit about that? Because that
Okay.
was a lot.
I think it's a fate that we meet. Actually, I don't usually do the online seeing patients online because of pandemic. There's not many people came into the office, so I signed up with this online seeing patients. You are actually not my patient. It's all everybody can be online. And I met you there, and you told me that you already have been seen by the ENT specialist.
Right.
I know I'm not an ENT specialist. A lot of the ear problem, if it's not a structural problem that the ENT can fix, they didn't see an infection, it's not going away by infection. A lot of times are energy blockage in the ear area. And the only way I feel that can help is really using acupuncture to open up the energy. But I do think I like to see, after I talk to you about your things, I'm going to share my other patient that I treat for vertigo, for Meniere's disease. But anyway, I think you were a spiritual person, and you do a lot of things to taking care of yourself. But at the time, I think you really need somebody to listen to your story, to really understand you, to take care of, because you're taking care of everybody else, but you need somebody to help you to taking care of. And I was there, and then I've actually helped you on the ear. The reason I'm doing this, I do think a lot of times because I have other experience to treating people with the ear problem. I'm not saying acupuncture. Actually, I have to say, acupuncture can treat about everything. Most of people think it's just for pain. Now Medicare pays for it only for back pain. They think it's only for that, but it's actually a whole body tune-up. So, but I think it's easier on you. I think I treat you probably 2-3 times, your problem is totally gone.
Yes.
I opened it up on the energy level there. So I'm going to tell you another story of my patient. So I have a 50-some-year-old patient came to see me because of dizziness and a little hearing loss. So she said it's been 20-some years. She was a PE teacher. So she was actually pretty healthy in the past. So she suffered what we call Meniere's disease. Basically, periodically she feel dizzy. The room is spinning, hearing loss, and blockage.
That's what I thought I had. Yeah.
Right. She had that. So she went everywhere. She went to Mayo Clinic. Okay. She had 1 ear, 1 surgery. I think the left ear, the right ear, she had 2 surgeries. She told me after the surgery, she was getting worse. And she went to a point that she could not work because if she's dizzy, she can't do exercise. So she stopped exercise, gained a lot of weight. And I was asking her, whether you have any stress at the time when this happened. She told me that she doesn't know if there's any stress, because she said later I did have stress. She had a son died of AIDS, and it was a drug user. And a year after that, she suffered for colon cancer. But she had surgery, she had chemo that was healed. But this dizziness continued to going on. So when she come in, I use not just acupuncture, I use actually Western and Eastern together. So I was asking her to when I do the acupuncture, a lot of times I haven't done it on you with using guided imagery. Most of the time I have a lot of guided imagery that basically is a guided meditation for variety of things. So I have for pain, for weight loss, for lower the blood pressure, for insomnia, fibromyalgia, all kinds of things. But I don't have one for vertigo, which is dizziness. I don't have that one. I happen to have one. It's called love and forgiveness. It's actually anger and forgiveness. I'm sorry, anger and forgiveness. So I said, you got to buy one and listen to it when you get home. So after she saw me, I think after the first treatment, she has not had any big vertigo, like the Meniere's. But she also have daily dizziness that totally I treat her for 3 months, and she lost a lot of weight. She was doing very good. And later I was asking the lady that introduced her to me, who is also and who is her best friend. And I was saying, I said, she told me she didn't have a lot of stress, and this person said she had a lot of stress. I mean, she was asking that person, said, why do I look like anger? Why Dr. Wen give me this guided imagery for anger and forgiveness? Actually, at the time, I didn't have anything that I fit her. So I think everybody has anger and forgiveness. That's why I give her that. But then later, from her friend told me, what happened at the time when she had this dizziness, this spell, is she had an affair with somebody and got pregnant. But that person was not responsible, asked her to have abortion. So she had an abortion. And she has 2 girls and a son. The son died of AIDS. This is like a few years after, but her 2 girls also involved with drugs. She didn't want to open it up with me, and her husband actually pretty nice with her. She had abortion, but her husband didn't know about it. So I think what happened, not only the acupuncture, kind of like something just to help her energy wise, but I think the guided image, the thing that she's doing of forgiveness, because she has lots of guilt. The person who asked her to see me for acupuncture is actually her husband. It is expensive. She have to pay by herself at the time. But later she went back. I think the forgiveness, I mean, there are somebody has willing to help you, but I do think it's very important, I want to say, is that you have to do your own self-healing. Like you are doing meditation, you're doing some like music therapy or energy therapy. And I think those acupuncture is not just one thing. It was like a magic. It is magic, but for long-term relief, you do need to do a lot of self-work. And I've actually promoting that patients to, and I tell them, when I have a lot of patients tell me this, when they have a pain, they go to a massage, okay? Mm-hmm. And they feel the massage help at the time, and later it doesn't help. And so they ask me, I'm not, of course, there are different people, there are different massage, but the thing is, you need to know whether it's massage or acupuncture, somebody doing something to you. So if I'm the doctor, I'm doing something to you. But when you do guided imagery, she was listen to me, she do it every day. Or when you're doing exercise or when you're doing meditation, you do something to yourself. It's a much more important healing power. Okay. So I try to cultivate patients. Even when you're taking a vitamin, you're doing something to your body will listen to it. It is very important. I do think it's important for you to have other people help you, I'm not saying massage is not good, but it's
okay, because I'm going in an hour, but go ahead.
Yeah, for your body, when you do something to yourself, even when you're listening to something like this, is you're willing to open up yourself, and that's very important.
Okay. So what I'm hearing you say is that although I come to get that acupuncture, and yes, you are helping me. You open up that energy, you keep it open. When I'm blocked, everything, because I think what's most important is you as my doctor, my energetic field too. And that's something that's missing on the Western medicine side. There is literally no connection. It's pure medicine, and they don't believe in the other part of that. But you know, when I lay on your table, you can tell me, you have told me things like, oh, you need to do A, B, and C. That's not something that I could just like a regular, just a doctor who doesn't believe in that other side of energy healing and energetic medicine and stuff would say or could see. So what you're saying is, yes, go over here and get all these things done by these people, but it's important for you to do the work too. Continue your self-healing.
Yes.
Absolutely. And all of us here on this call, we are committed to our self-healing. Everybody on this call, they are involved with pranayama, breath work, yoga, meditation. Like I know for a fact that they are really heavily invested in themselves. Thank you for that. Because that's so important. When did you know, or like when did you realize that you needed to integrate the Eastern medicine with the Western medicine? Or have you always known because of your culture?
Um, I think, first of all, I think my mom is a good example for me. So she is also graduating from the Western Medical School.
Okay.
And then later she was doing combined Western and Eastern. Actually, now I know she's doing some functional medicine. So my story is after 5 years, after I did my residency in Cleveland Clinic. I finished it in 94. So about after 5 years, I think I'm pretty set with the Western way of treating medicine. And then I was thinking about why they want to come to see me. Because when I was in the, I remember I was in Cleveland Clinic and I was very stressed. So they asked me to see a psychologist, is a who is a Korean doctor. So this is what he told me. He said, in the United States, the way they think the best doctor is a middle-aged white man, which is, you have to be English Saxon. He said, you have no problem, except you're not the typical type of people. They think you're a doctor, you're a woman, you're Asian. You know, that's the way that he proposed to me. He said, you got to get into the American way. You got to read, you know, New York Times Sunday issue. I still don't want to do that. Yeah, anyway, so I was thinking about why they came to see me versus a white doctor, you know, a man or something. I know I'm a woman, I'm more caring. Just to be nice to people is not enough. You can still kill a person if you don't have the knowledge. And I was thinking back. So what's the, I know they maybe is a white man, you know, people more trust you, but I think my advantage is my heritage. I'm Chinese. So if I can do some Chinese medicine, then just to explore what I'm good at it, at least I know Chinese. So for me to learn Chinese medicine, I've already learned it before. I can pick it up and you need to learn a lot, you know, and it's much easier for me. So I started about 2000, maybe a little bit before that. So I started to go to Canada. At the time, they have a CME, which is continuing medical education classes on acupuncture. So my in-laws is there, so I flew back and forth to pick it up because I haven't used it for a long time, you know. So I incorporated, but after I incorporated, after 2-3 years, I just feel it's not enough. I have people come in with bag and bag of vitamins, and they say, can I take this? Can I take that? And I feel the acupuncture alone really is not enough, because if your body is lacking some kind of nutrient or vitamin, but in the traditional Western medicine school, we don't, our talking about diet, probably a couple of hours, literally not too much of vitamin, a little bit. At the time I went, I was talking to my friends. I was doing some biofeedback and different things. So they introduced me to Dr. David Rico, who wrote a book on integrative medicine. So he recommended me to do the fellowship in integrative medicine. So I think I'm going to talk to you a little bit about what is integrative medicine.
Yes.
Okay. So the integrative medicine actually for the, I think the most important things you need to understand, it is not just the toolbox, you know, like you're using acupuncture herb or something. It's basically a relationship with doctor-patient relationship. That's the most important thing. And the doctor-patient relationship account to about 60% of the healing. 40% are the medicine, surgery, or the other things.
Oh
so
God.
that is a very important thing. And the integrative medicine is holistic ways, is really centered on prevention, on taking care of the patient, you know, things like that. So it's basically have 5 components on the integrative medicine. One is biochemistry, that it's like food, herbs, vitamins, even Western medicine. This is all bio, you know, hormone, probiotic, and all that, fibers, kind of like things. And the other one, the number is mind body medicine. We learn a lot of mind body medicine, like meditation, guided imagery, hypnotherapy, and which is very, very breath work, journaling, art therapy, dance therapy. We learned all that there. And the other one is biomechanic medicine. That's kind of like hands-on. So that will be like chiropractor, massage. China has one, is called Tuina. Is the massage of the meridian, you know. And I learned a strength counter strength. It's a technique for pain. There are lymphatic relief, physical therapy, this hands-on thing. Somebody put the acupuncture there. You can put the acupuncture on the next ones, like energy, bioenergetic medicine. That will be Reiki. I think Toshia does that. Qigong is a Chinese breathing and different things. Healing touch, actually you don't have to touch people. Therapeutic touch, grounding, zero mean balancing. There's a lot of energetic, and there are remote healing type of things. Even I would say prayer, that is energetic medicine.
Right.
And the last one is the other alternative medicine. So that would be like traditional Chinese medicine. We have our own whole array. So we have our own herbs. We have our Qigong or Tai Chi, and we have our Tuina, acupuncture, you know. And I also learned Ayurveda. On the integrated medicine fellowship, you can pick either Chinese medicine or Ayurveda, which is Indian medicine.
Yeah.
I thought, I'm not going to let Western people to teach me Chinese medicine. So I learned, so I took the Ayurveda, and I also have homeopathy. I learned the basic on that fellowship, but I take the homeopathy. I've actually went to classes on homeopathy. So homeopathy basically is kind of like vaccines. You use a small dose of the thing that causes you, let's say, asthma, and you dilute it like thousands of times, probably 10,000 times, and then use it. It's very safe, even for babies, it's very safe. So I do that too. But even after that fellowship, I still don't feel comfortable to use vitamins. They learn a little bit, it wasn't very intense until I moved to Las Vegas 2010. And I was actually listening to Internal Medicine Update, which is talk about functional medicine. And then I have some friend that I'm asking them. So I get into functional medicine, which are more doing a more biological approach. I think they do a lot of special tests, try to find out the root cause. You have to balance their GI system, their hormone system, learn about toxin. I learned extensively about vitamins, herbal things. So I'm more comfortable now to kind of a more holistic way. So Toshia want me to tell you what else that I do in my office. So I do IV vitamin. It's called a Myers cocktail. It's a cocktail of high dose vitamin C, magnesium, calcium gluconate, B5, B6, B complex, B12 to IV. So any kind of acute, when Toshia see me, she's not very acute, but I have people, let's say has COVID, some acute infection, acute pain, or have people try to get, I have actually a addiction counselor send me a lot of people want to get off narcotic or any drugs and stuff. I give them IV vitamin. And I have people who have weight surgery way back a long time ago, so they don't absorb vitamins well. So then they have to come in periodically to get IV vitamin. I also do ozone. Ozone is O3, it's a heavy dose of oxygen. Ozone has a lot of use, but you can actually draw the blood out, mix with the oxygen, the ozone, and then with some anticoagulant, and then infuse back. But I don't do that because you need a nurse. I'm just by myself with my husband as the front desk people. So, but a lot of patients come to see me because I do acupuncture. So I do a lot of, I do this ozone injection. It's called the polazone. So instead of as regular doctor just inject steroid, I inject almost like my Meyer cocktail is a cocktail of vitamins with a little steroids, followed by ozone into the joint or the muscle where they hurt. I think since I've been doing the ozone therapy, I've been doing less acupuncture for pain per se, but I do have a lot of people just come in to for stress or for other things, like infertility. I mean, ozone cannot do that, but I have people doing acupuncture for infertility, for for different other stuff. So I do that. Most of my patients, I've actually given them herbs or vitamins, and I spend a lot of time. I think the doctor-patient relationship is very important, and if you want to find out the root cause of the disease, you really need to know that person. Yeah. So my new patient, I spend an hour with them.
I think you spent more than that time with me. It felt
like 1 to 2 hours the first time, because I did acupuncture. That takes about another hour. Mm-hmm. And I like to do acupuncture. So I asked Toshia, I say, once you're here, and I asked her to come in twice a week. When she's doing better, I say, you have to do it once a month. I always tell my patient, I don't care what type of thing you do, you need to do something regularly to tune up. Yeah. You can do acupuncture, you can do massage, chiropractor. Most of the time after 50, no matter what disease, I recommend them to see a chiropractor. Mm-hmm. And in Chinese medicine, this is what we think. If you have a mental problem, you started with the body. So you do massage, you can do acupuncture, you can do chiropractor adjustment, to get the body energy flowing, exercise. So you need to started with the body. If you have a body disease, stomach ache, or or you have a body ache or something, you need to try to find out what's going on in your brain. Mm-hmm. What's your life? You treat actually from the head down. You need to find out the root. When you have the head problem, like depression or anxiety, you actually treat the body first. So a lot of people, they can't focus. You tell them to do meditation or something. Mm-hmm. Sometimes they can't do it. They're too overwhelmed. So you start with the body.
Mm-hmm. Oh my God, this has been like eye-opening. Just the stuff that you said really quick before I forget. We're already at like 4:34. So around 4:45, we'll start with the question and answer. If you have a question for Dr. Wen, make sure you put it in the chat. Please put it in the chat. And then once I get the question, And then I will ask her these questions, and then she may ask for you to expound on it, for you to unmute yourself and keep going. If you don't want everybody to know that it's you asking this question, you are welcome to do it privately to me, okay? And then we'll keep you anonymous. But you know good and well, it ain't every day we can have an actual doctor to sit here with us and talk to us and answer some questions. And you know she got it going on if she's my doctor, okay? So with that, really quick, I want to know, Dr. Wen, you said that the patient doctor's relationship really has something to do with the health of the patient. This is true, because I mean, I know everybody can attest to it. You go to the doctor, they come in, and I've worked at the ER at the public hospital here in Las Vegas. I used to go to the ER doctors meetings. So I know how the director used to be like, you're spending, they're clocking them. You're spending too much time with this patient. Get in, get out, get these patients seen, because it's time is money for them, for a doctor. How did you get past that? Because our relationship is so good. Like, I can come in there and I know that you're hecka busy. Even when you're so busy, because y'all, she is super busy, she will still take at least 10 to 15 minutes to talk to me and see how I am doing. How in the world?
I think I have to get my, it is because I've actually get my overhead down. That's why I don't have a nurse. So I can, most of the internal medicine doctors see 20 patients a day. And I'm seeing about 10 patients a day.
Right.
So even though I'm busy, I'm actually spending a lot of time with the patient.
Right.
I have something here I want to share with people, my philosophy. I don't know, I'm just using 5 minutes. Is that okay? About what I think is health is a balance of mind, body, and spirit. And a lot of people will ask me, what do you mean by mind, body, and spirit? Because it's like a big word. So I just want to tell you how I approach patients. So mind, for everything, I think mind have an in and out. So the in, is positive thought. That's the most important thing. And the other one is nutritious food. Another thing is water, sun, and the air. It's very important. And out of the mind, a lot of people will think about detox. So the first detox I'm thinking about is to get your negative thought out. That's the first one. So you need to be poop right most of the time, and you need to be urine right. You need to have a kind of an alkaline urine and sweat on the daily basis. So there's 4 in and 4 out. That's for the mind. The body needs rest and exercise. So I teach people what is the right sleep. It's not just what amount of sleep you get, it also the time. You need to be balanced with the sun and the moon, because a lot of people sleep too late. And you need to take nap if you can. The rest also including meditation, prayer. The body, besides rest, it needs exercise. So exercise, I tell people there are 3 components. One is aerobic, like walking, playing balls, swimming, biking. Strength is very important, weight training, and also balance and flexibility, like doing Pilates, yoga, Tai Chi type of things. Mm-hmm. The spirit has the authentic and inauthentic. The authentic always lead to love and forgiveness, and the inauthentic, it goes to blame, shame, and guilt. So when I treat a person, it's kind of like triangle. So you started with the lifestyle way to treat the patient to balance all the 3 things, all the above. When that's not enough, I will use like supplements, herb, and acupuncture. When that's not enough, then we use the Western medicine and surgery. Will preserve that for the last. So it's like a triangle, is the narrow one. But the Western medicine, they flipped. They use a lot of medicine. They don't get into the diet and the lifestyle.
Mm-hmm.
So this is the way how I interpret my body and spirit.
Wow. I mean, and that's a lot. And I know that the ladies will agree that that's all inclusive. And I mean, a lot of us are so busy with lives. Some of us are mothers, some of us are caregivers. It is so hard to try to balance it all. It's like, for me, obviously, I've gained a significant amount of weight during COVID. I'm not as active as I used to be, and I hate that, right? And I know I got to get back to it. I know it. My body talks to me and tells me, oh, it's time. But it's just so hard for us to have this healthy balance. Sometimes it just feels like just pop a vitamin or two, and you're like, okay, maybe I'll be good because I'm popping these vitamins.
I think the most important things you have to pray on the what is your priority is that you're talking about kind of like time
Yeah.
things. So you need to practice. I like a way say it. A lot of times we see what our priority, and most of people think that they have a list what they have to do today, and they prioritize what is on their list.
Mm-hmm.
But I think the most important thing is to actually put your priority on the list, because a lot of times our exercises, it really needs to be, you're not scheduling your priority. So that is very important. Then you have to be able to ask other people to do your work. But sometimes, like you, if you really, really don't have time, I ask a lot of people to do the HIIT, the high
Yes.
intensity interval training.
Okay.
Sometimes, okay, you can do 4 minutes a day.
Yes. I can do.
Even if you do HIIT. Some of the HIIT, there is, I forgot what that called, the therapy is, before each meal, you do 1 minute of HIIT. So it can be run, jumping rope, or even running in place before each meal.
Oh my God.
It can, a lot of people even lose weight. So if you cannot find 3 minutes in your life, then something wrong.
No,
And
you
then
can.
you're not
You're right. It's priority. I can find
right.
3 minutes. It's just, it's saying, you're absolutely correct.
You have to schedule your priority.
Yes, ma'am.
Okay, in there, because
Yes.
a lot of people, the priority, taking care of their health is not on there. It's all other people's stuff. Then you have to be trusting other people. I mean, if you don't take care of yourself, then you can't take care of other people.
Lord knows that's the truth. And just knowing when to say when. Is there anything that, as a physician, and I'm just going to be a trend, you and I, we just talk very matter of factly. And that's what makes our relationship really great. And I know with my listeners here, they know me, and I'm really open with them and honest. Is there anything you want Black women to know? Because a lot of us don't trust doctors. I mean, in childbirth, there's a high mortality rate when it comes to childbirth. They treat us like we're horses, like we can just handle all the pain in the world. Is there anything you want us to know?
I think, well, you need to be trusting your doctor. So if a doctor, you don't think their philosophy is the same with you, you just have to switch a doctor, I think. But other things, you have to trust your body, to listen to your body. Even though the doctor may say this and that, but to hear yourself is actually not other people can hear you. You hear yourself. That's a very important thing. I don't know. I think if the doctor, I know it's difficult to find a doctor that's in line with you and also take your insurance and stuff. I know that's I don't know how to solve that problem, but you can find one. And actually, my own doctor is a nurse practitioner. She's Black.
And I think that, like, for me, and we need to trust ourselves. Like, because I do a lot of referrals out, like, especially if it's a mental situation, I push clinical therapy, because women of color desperately need clinical therapy to handle the amount of PTSD, not only from past generational pain, but just everyday societal pressures and the shenanigans that we have to face, and so we desperately need to take care of our mental health. But I will say that if you don't feel a connection with your doctor and you feel like they're rushing you or being changed, like Dr. Wen said, change doctors, don't even play with your health. If they're not going to take a few minutes to listen to you or talk to you, just find someone who will. It might take you a minute, but it's very, very important. I think so. Thank you so much, Dr. Wen. This has been eye-opening. We have some questions. I'm going to slide into the question and answer because we're already at 4:45. So let's go to the questions. The first question we have is, it says, Regina, can you unmute yourself and ask, because I'm missing some words. It just says, can you do well on blood thinners? What's your question?
That means I know what she's asking.
Okay.
She's asking if you are blood thinner, can you do acupuncture? Of course, definitely. Okay. The needle is very thin. It is solid. So when you get a vaccine, okay, you still have a hole, and that you can put 16 needles into it. So it's very thin. When you're on blood thinner, you can get vaccine. You can still do injection. That's not a problem. I don't know. I cannot unmute her. You can.
I can't. Okay. Regina, did that answer your question? There she goes.
Yes, yes, that answered the question for me. Just wanted to make sure with all the different, but she just explained the size of it. That's tiny.
Yes, it is. Mm-hmm. You look fly with the glasses, girl. Thank you.
Oh, thank you. Thank you very much.
Let's see. The next question is, does acupuncture work for alopecia?
I didn't see that question. I have not used it for alopecia. No. I think that you really need to know why you have alopecia. A lot of times because of hormone, because of different things, and vitamins and too much stress. I haven't used acupuncture for alopecia.
Gotcha. Okay. If you have another question to follow up with that, please send.
I see here from Andrea Blake, right? What do I do about the knee pain on my side? And I think most of the time the knee pain with ozone shot is very good. A lot of times sometimes it's because sometimes I send them to the chiropractor, certain chiropractor, because your alignment is wrong. So you need to get that adjusted. I had a skater. I did acupuncture and it wasn't helping her. So I sent her to chiropractor. They say that she was misaligned, and every time when she's doing a step is misaligned. So you need to do that. A lot of time I send them to physical therapy. They need to get their quads well. Everybody is different. So if the acupuncture, let's see, he said, I've done 4 acupuncture to heal the pain, a bit of excess. It has, if that's the case, the acupuncture actually very good for the knee. But if you have, like, let's say torn meniscus or something, they're probably not going to do it. So most of the time in this situation, I'll do the ozone. If ozone doesn't help, well, we need to do the MRI, because if you have a meniscus tear, sometimes ozone will help. Sometimes you need surgery or something. Because if it's not working, then you have to go to see. I mean, like the person say, they could be the alignment, and it could be because your pelvic is the other joint, the unalignment. If you don't do the alignment, every step you take, it actually hit the knee like that, and you will have pain. If you don't adjust that, it's not going to help.
Oh, wow. That's something that I really believe I need to see a chiropractor. I really do. But I have knee pain because I blew it out at a gym. So blew my knee out. But
A
however,
lot of some chiropractor may not to do that adjustment, but is a good one that will.
oh wow. How do you know you got a good chiropractor? I mean, you just have to go off the reviews. Just have to
Well, I happen to know one, but he doesn't take insurance. This is like anybody else. Most of the time, you need to ask your friends and stuff. It's a word of mouth, and you have to kind of, ask.
Mhm.
It is hard to find the right person, no matter what treatment you are doing.
Yeah, that's true. Regina has another question there, Dr. Wen.
Okay, she can ask.
She said, can the energy blocks be from someone else?
Definitely. It's very, very common, the energy block from another person, but instead of working on another person, you can work on your energy yourself, how you can't change a person, but you can change the way that you react to the person.
Mhm.
And I remember, so I do a little bit NLP, even though I'm not an NLP professional. So I remember that I had a patient came to see me, and I usually ask them their major stress is her boss, and she was talking to me about a lot about her boss and doing this. I said, you really, really loaded up about what your boss treat you. So next time when you see him, you can think that he is just like a child wearing diaper and running around, doesn't know what's going on. So she was laughing. She was actually crying there. I said, you don't blow him up. You shrink him.
Oh, I love that,
You
guy.
can do that. You shrink him. And he's not God. You know what I mean? You blow him up. You shrink him. He doesn't know. And she got a lot better after that.
Oh my God, I love that. I'm gonna start telling people, y'all hear that? Oh yes, Regina. Ding, ding, ding. We got this thing where we hit the bell when we hear something good. Oh, that's right. Let's give that to Dr. Wen. She needs that. I can't even find the bell. Good Lord. Oh, here we go. Okay, that was good. We like that. Make sure y'all remember that. We got to say that again, because I know a lot of us always complain about our bosses or the people in our lives that drives us crazy. So we need to just start imagining them like they're wearing some poopy diapers running around. There's another question there.
I think there's one says is from Zen, right? I have 10 plate and screw in my right ankle due to the bone fracture. Acupuncture, a lot of times if it's screw, I will do the ozone shot. The acupuncture might help. It may take a lot, but a lot of that, and I really recommend you to get the book. Well, the other day I was talking to Toshia about the EFT tapping. If it's a very complicated thing, I think there's a book. It's called the tapping solution for pain. So we can think your problem is more complicated. It could be a lot of things around that pain. So to do something on yourself is very important. So I will tell you on this book, they're talking about tapping, basically tapping on different meridian point, the acupuncture point, and then saying things like, even though I have this pain in my ankle, and I still deeply and completely love and accept myself. So pain is, you can imagine that as a tree. So any symptoms, either it's a pain, or I can't sleep, or tired, or something, that's just a symptom. It's like the leaf of the tree. The branch is emotion. It could be frustration. I'm frustrated. I have this pain there. I could not do the thing that I like to do, or it could be an anger, or it could be, I don't know what happened that you felt. It could be anger for yourself that you felt, or it could be something, that's kind of emotion. It can be frustration, it can be anger, it can be anxiety, it can be depression. You can tap in on that to decrease that. The tree trunk is like event, something happened during you fell or injury, that event, you can tap in on that event, because a lot of times we don't let go of that event. It could be an event from our childhood. Something triggers this pain, actually triggers something else. And then there was the root is like a limited belief. It's kind of like, since I have this plate, I always have pain, something like that. And you can tap on that. Miracle can happen, even without the acupuncture, it may heal, because there are 4 levels of different things involved to pain, especially chronic pain. You can tap on each level. I think acupuncture or ozone something is just through a booster, try to help you. But definitely I do, like I have a Black patient, actually, she has a plate and screw on her back, and I give her, I have been giving her the ozone. It helped her. I have to say it's temporarily, because there are things I cannot help her. Her son died of a car accident. Her son was in jail and died of a car accident. She was very mad with the police that handled the case. So I don't know who is wrong, but they think her son is wrong or something. But there are 3 people that is a big event. She's not let go that. She's grabbed on that. I give her ozone. She was pretty good until that event happened. And sometimes she's too stressed. And I'm talking to her. Everybody's healing. It takes time, and she has to be willing to let go of that. If she doesn't want to let go of that, there's no way I can get her off that.
That is so pivotal, what you're just saying. Like, people can come and get I know that for a fact. A client can come and get all the service they want, and they are still plagued with the same things that they started with. If they're unwilling to let go of certain pains and the shame, the guilt, the anger, no matter what you do, it will help for a little while, but that's probably going to still be there, and then come back and be played with this, because they are unwilling to do their part. We can only do so much. Your doctor can only do so much. If you go out and you want weight loss surgery and all this kind of stuff, you want this doctor to help you, fix you and stuff, what are they supposed to do if you keep eating and overeating and doing all? They can only do so much. That's why it's so important that we take care of our psychological, because it directly affects our physical. And sometimes the psychological can blossom into something physical. Is that right, Dr. Wen?
Yes.
We have,
and you have to know, a lot of times, I'm not saying you constantly doing this, but pain sometimes has benefit. A lot of people have secondary gain. I'm not saying that person has, but there are people sometimes we're not aware, because if we have the pain, we don't have to deal with certain things. So you have to let go with, you have to know, if I don't have the pain, what can I do? And the tap-in the solution, that book actually talk about that. It's very important. You have to think about it.
I love tapping.
What is good to have this pain? And because a lot of times, I have people, the very difficult one is that they are disability, and they tells me so important that money comes from the disability. I know that kind of things is very difficult for me to give them anything to help them on the pain, because they benefit from that.
Oh my God, y'all, that is so huge. Yes. So a lot of people, don't we talk about that all the time in our sessions? Some people are addicted to pain. They are addicted to that pain. They could not imagine their life without this stress, this pain, this drama. You take them and try to help them heal, and they will go and find some new pain and drama to to replace the old one. We got one last question. I have been, did we answer about the right ankle? Yes. I have been plagued by vertigo for years, and hearing about blockages and stress today makes me wonder if that's why it seemed to appear out of nowhere. Only recently I have had any episodes.
Definitely.
Wow. Oh my God, Sansia. That is that's huge. Oh my God, guys, thank you so much. It's 4:59. I want to be very respectful of Dr. Wen's time. She is not charging me for this, okay? So I need to be respectful of her time, okay?
Well, thank you, Toshia, to let me talk to your friends.
Yes, yes. It's been a pleasure. It's been so good. I hope you guys had your questions answered. I really appreciate you spending your hour with us on this Saturday. And I know you could have been anywhere. Yes, Regina, and you are here in Vegas. Go see Dr. Wen. Thank you so much, Dr. Wen. I appreciate you. I'm grateful for you. And I'll be
You're
in there to
welcome.
get me some hypnotherapy for weight loss. So I can get rid of these 30 pounds, honey, because this COVID did kill me. Oh, you're so welcome, guys. You're so welcome. I'm so glad you guys got something out of this. I definitely want to share a person who's pivotal in my life and helped me in one of the darkest moments of my life and who is very important to me. And I see her like clockwork every month. I don't give a ding dong what coffee I'm not going to drink. I'm going to have my money for my acupuncture and whatever else she tells me I need to do. So thank you, Dr. Wen, again. Thanks, everybody. Have a great night. Be well and stay healthy. Good night.
Thank you, Toshia. Thank you, everybody.
Good night, guys.
Bye-bye.
Bye.